Hi, my name is Dr. Samintharaj Kumar. I'm Director of ZAGA Center Singapore. I've been a practicing dental implant surgeon since 2001. I have worked for the last 24 years as a dentist, and I practice in the sunny island of Singapore. Today, I will be speaking to you about some commonly asked questions about what it's like to have implants at ZAGA Center Singapore, and also some questions about what removable appliances are, prostheses, and what fixed prostheses are. In addition, I will also describe to you certain differences between crowns and bridges. Looking forward to spending more time with you guys and letting you know what the various options we have at ZAGA Centers. Let's do it. When someone asks me what a dental prosthesis is, this is something which is to do with the top part of an implant. So an implant basically is a screw that's anchored to bone, but what's above the gum is commonly known as a dental prosthesis. In some countries, it's known as an implant crown, and that basically has usually a hollow channel through which a screw attaches and anchors itself to the implant. So the dental prosthesis is something which is hard wearing and typically lasts anywhere from 15 to 20 years. It can be made out of different materials from porcelain fused to metal. We prefer zirconia these days, full ceramic restorations. They're extremely hard wearing. Some patients have a tendency to break crowns, and certainly if you're one who does this, you might consider a gold crown. And gold crowns have a much better wear resistance compared to porcelain fused to metal crowns, where you might see the porcelain chipping over years. In terms of the all-on-4, a dental prosthesis is what we call the all-on-4 bridge, which is anchored to 4 or 6 dental implants, and this is typically done on a single day at a ZAGA center. I frequently get asked questions as to what a dental crown is. A crown is done when sometimes a part of the tooth has broken off to the point where a filling is too insufficient in terms of strength. So if you like, a crown is a cap. It covers the entire tooth, and because it circumferentially covers the entire tooth, it's much stronger. Now, what is a bridge? A bridge actually is a combination of a few crowns together that are fused, and typically there are gaps between these teeth. And for example, let's say 2 teeth are missing. You have to crown the tooth beside these, and then you have 2 crowns with 2 fake teeth. We call them pontics, and this 4 will be called a dental bridge. In terms of getting people to be rehabilitated immediately, we have 2 options. The first option is a removable denture, or the option which we prefer at ZAGA Centers is a fixed bridge, a bridge that can be received where implants are placed within 24 hours and you can start eating again. Now, the difference, of course, will be that one is removable, which has to be removed every night, and will also entail a different sort of maintenance compared to something which is in your mouth. When you wake up in the morning and look yourself in the mirror, you'll find that the bridge will support your lip, whereas if you don't have the removable denture in your mouth, your lip will fall back. The second thing, of course, is that when you have your own teeth, you have to floss. Now, with a removable denture, you have to take out the entire thing to clean. It can be a bit embarrassing when you're going to the toilet or bathroom after having a meal or so. When you have something that's fixed, you clean it absolutely the same way with a toothbrush and floss. We also advocate something called a water pick. Between both, we find that the patients who have a bridge, which is fixed, versus someone who has something that's removable, they will be able to confidently eat hard food. And also when they present or they sing, they'll be most confident. If you were to choose between both, you know which is best. In terms of attaching a bridge to dental implants, there are a few ways we do this. In terms of the removable version, there's something called a locator attachment where we actually have a female and a male component, and that basically snaps shut. And when it snaps shut, you can obviously remove that. The difficulty with this, of course, is that the tongue can go to the back of this and release this, which means as you're eating or when you're speaking, it can come out. Now, the brilliant thing about an implant-supported bridge is that it's screwed in and you can't take it out. But guess what? The dentist can. And we do take this out periodically to clean it and service it, of course. And it's attached via small screws that go through the bridge, straight into the implant, and then we cover the top part of the crown where the excess cavity is to place the screw. Now, of course, both will require some form of maintenance. As you probably realize, things that don't move so much will require lesser maintenance than things that keep moving a lot. So the removable bridge or removable denture will require more replacement of parts that are inside, commonly the elastics or small little female components inside. At ZAGA Center Singapore, we have a very good protocol as to how patients get their teeth on a single day. Prior to the event, we would obviously get them completely checked out medically to make sure there's no problems with the blood tests, make sure they're not diabetic and stuff like that. Then in terms of actually on the day of surgery, we tend to start the all-on-4 teeth and air process at 7:30 in the morning. So you'd have to be fasted 4 hours before. You can have this under intravenous sedation or general anesthesia, or even things like oral sedation or so. The surgery takes about 1 or 2 hours, and after that, we usually will do certain parts where we have to do try-ins or first fits for you to assess whether the smile is right. During this time, you'll be sleeping in a recovery room, and we will then take you out of the recovery room 2 or 3 times. You'll be served lunch at appropriate times. Yes, you won't have teeth at that point, but usually some soft thing like porridge or so. By the end of the day, usually about 4 or 5 o'clock, you will leave having implants that are in your jaw and a fixed bridge that's placed. And this bridge is very, very beautiful in terms of how it looks like to externals when they see. It's also very comfortable as well. You're meant to be only eating soft food for the first 8 weeks. Most patients complain of very little pain. We do tend to give long-acting local anesthetic that keeps you quite comfy for the next 8 to 10 hours. And we usually get you to take painkillers for about 5 days or so, and obviously some antibiotics and a mouthwash. By the end of that 1 week, we will remove sutures, the stitches, and then you're back to normal. Expect to be away from work 3 to 5 days, and you can get back to work the week after. In terms of pain for any form of dental procedure in my group at ZAGA Center Singapore, we typically tend to give patients painkillers before we start the procedure. We're talking about 2 good painkillers, which includes paracetamol combinations with some form of codeine and some form of NSAID, which could be something like atirocoxib or, for example, ibuprofen. In terms of what else there is outside, there's also holistic medications like homeopathic medication like arnica, for example, which we commonly give as well. We tell our patients to avoid having hard food. If you have hard food, that's not going to help with the pain control. Warm, salty mouth rinses also are very useful. And we tell our patients to try and rest. If you get back to work immediately, and if you're stressed, this will also cause more pain. Your perceived state of pain will be altered by the circumstances around you. So if you have good rest at home, you probably have a very uneventful, painless or pain-free recovery. As far as possible as a dentist, my job is to save your tooth. Now, an implant is only looked upon as an option if that tooth is impossible to be restored to function, or it costs just far too much, or the risks are far too much for us to consider replacing the tooth using all the various techniques that are available to us. Let's, for example, look at a large filling. If a patient has a large filling, one option would be to place a crown on it. But if there's too little remaining tooth structure of your own, then it might not be possible to save it. And sometimes we may need to do a root canal treatment. Now, if the tooth is actually mobile, if it's moving a lot, then it's not worth doing root canal treatment. So in instances like this, it might not be useful for us to try and save a tooth, in which case then we'd suggest an implant as the next best permanent alternative to a missing tooth. The tooth is taken out, and then an implant is typically placed on the same day, and you get a crown within 3 to 4 months. At ZAGA Center Singapore, we have plenty of patients who actually want to speak to people who have had it done before. And this is where we find that the experience that someone has had before with us really, really counts. Now, you can't see these on Google reviews, you can't see this on the website, but when you come down for an appointment, we'll then signpost you to some very kind patients who've gone through the entire process. And it's best to speak to them. A very frequent question is, how much of pain will I be in? How much of bruising will I be in? And when will I be able to eat? When can I get back to work? So if you have these questions, come prepared, and we will get you to speak to someone who's gone through this. Most of my patients will go through some form of swelling, but very few people actually complain of severe pain. Some may get bruising, especially if you're the older years. You get a bit of bruising in the neck or so. That's the way gravity works, and that's the way when you bruise, it can go down to the neck. So that probably is the most unappealing thing about surgery. In terms of getting back to work quickly, most patients get back to within 3 to 5 days. I've had some patients who've had to want to work the next very day or flown off from Singapore. Rest assured that it's a tried and tested technique. This is an international technique. It's very well known and well described. The procedure that you will be undergoing is teeth in a day, and that's what is the all-on-4 concept. And here at ZAGA Centers, we work on zygomatic implants for those patients who don't have enough bone, and we give them the smile of their dreams in a single day.